I've literally stopped learning when I was practicing because I think I was drowned in so much work and there was just not enough mental strength, brain bandwidth, whatever you call it. Just could not. I didn't feel motivated. I wasn't driven. There was nothing that was driving me forward to do more. It's now that I realized that, oh, my why I'm doing this is so much bigger and I'm so driven to do more, to learn more so that I can provide better and really impact healthcare differently.
Yes. I think the overwhelming situation of the doctors, physician, and the burnout of the doctors, and I think the system, the classic system, is not is not beneficial for neither for the for the physician and healthcare professional, neither for the patient. It's not normal that a resident work for 13 hours. It's not 30 hours. This is not normal. This is unhuman. Imagine that you are working in ICU for 30 hours. It's not, totally unhuman, and you with a sleepless night. And how can you explain to to this intern, this resident, that he need to do publication because he needs to improve his curriculum? How to explain to this doctor that he needs to learn about the case that he's seen in the ICU, and he needs to check what was the new updates about how to manage the severe acute asthma? We cannot do this. We cannot do this because we have a shortage of doctors. We have a shortage of healthcare professions, but we have very abusive mindset of healthcare system. And I think it's important to understand that you see the strong doctor and the he's a human. He has a family behind him. He has mother, a sick mother. He has a sick father, and he has family behind him. And he cannot take care of his own family because of time, and he cannot learn. He cannot understand that there is a good new guidelines. 225 to 2025 for diabetes. He cannot check for the updates for asthma. He cannot check for the updates for heart failure. And it's more challenging to tell him to check for what is the role of artificial intelligence and generative and agentic artificial intelligence in the healthcare management or in the management of acute coronary disease, and how new medical devices are advanced to predict the acute coronary disease before its occurrence by hours. You cannot do this. We are very, very flexible, and we are very high intellectual, but we are human. We should stop this burnout. And I think one of the benefit of technology is that it can help us in the paperwork. It can help us in the stop this burnout issues that most of the doctors all over the world are suffering in developing countries. I understand what you are saying about work, the load of work and the flow of work when you are a clinician. And I remember one of the situation is I have worked in department where the our head and the team, our seniors are very uh, are very tough with us. They are very demanding. They don't care if we have 10 admission or we have one admission. It should be the profile should be perfect. Should have all the data of the patient. And even if you don't sleep 1 minute, when you present the patient in the morning meeting, should have all the data of all the patient, and you should know from the first patient to the sixth patient, should understand every detail of every patient. And if they ask you a question and you are not answering, this is big issue. You are not good doctor. And this is very, very bad, abusive approach of medicine. Fortunately, after this, and then imagine this is my first internship in the first year of internship, and this is very, very tough. When you go back home, you need to sleep, you need to eat and sleep. Well, it's like a vegetative life. You are not living outside of the hospital, neither in the hospital, and that's why we need to change academia. We need to change the training of our physician. We need to change the mindset of our physician, and we need to understand that the student and the resident and the intern of today is it can be my physician, my doctor, when I get older and I get sick, if we don't teach them very well and we teach them how to be empathetic, how to understand the pain from the patient, we will suffer. We will suffer because we will see bad doctors, non-empathetic doctors, and totally outdated doctors.
I think we are definitely seeing some of those. From what you're saying, I think maybe some of us should actually go. That's where the role of a doctor is beyond just the clinical walls, right? Where they can actually come in and see, how can I improve the system? How can I make this better for my peers? How can I support this?
I think we can help tech. We can change the healthcare system by improving the quality of health tech and by improving the innovations, by being the voice of our patients in the technology firms and the technology startups. I think it's our perspective as a doctors advocates our patient, and I think also the patient, they need to be involved in the health tech innovation, because they are the end consumer, and that means if they are not considered and they are not taken in consideration, this is a big failure of the health tech. Whatever you can have very high technology that uh, it's treating a big issue in healthcare, but it's not accepted by the healthcare professional and by the patient. It's a big failure. We'll invest. You see that a lot of big startups that failed because they're not responding to the needs of the patient first, and second to the healthcare professionals. They're ingenious. They have ingenious ideas, but the projects are not responding to the real need in the real field for the patients, for their families, and for the doctors and the healthcare professional and for the healthcare system. We don't need the technology to be so advanced. We need a technology that fill a gap, and a relevant gap and urgent gap, and it will succeed. Maybe as healthcare professionals and doctors, we can show to the health tech companies and startups what is the painful issue, what are the things that need to be fixed, what are the things that need to be improved in the your technology. And I think it's a part of involvement is crucial, not only for the healthcare system but also for the companies and for the health tech startups.
Mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Join Disruptive Doctors. Oh, Disruptive Doctors.